I started out my career as a radiologic technologist. One of the most appealing things for me was the combination of taking care of patients and combining the technical expertise. I felt like radiologic technology was a perfect fit for me. So if you want to be successful as a radiologic technologist, number one, this is a patient care position. So you've got to have the ability to be compassionate and want to take care of sick patients, often in the time when those patients are not at their very best. For me, I've always found that one of the most rewarding things is being on the front line of patient care. Often patients come in with multiple injuries or symptoms, and the physicians are just trying to provide the very best possible care they can. They often turn to imaging to help solve that problem. We touch almost every patient that comes in the organization. We're in the operating room, we're in the emergency room, and we're taking care of the walk-in patients. Often those images that we are providing to the physician is going to make a critical determination as to the next step in the patient's care. So our job is to be as quick and compassionate as we can to provide the best possible images. We don't interpret the images, but we produce the images that do get interpreted, and that helps determine the patient's care. The field of imaging services, it is very technology heavy. AI has really become mainstream now in imaging. The things that AI can do is, number one, auto-position the equipment to provide a more efficient process for the patient. We have AI that can enable us to use less radiation and thus creating a better image and aiding the physician in the diagnosis. You can quickly enter the medical imaging field through your community college. Within 2 years, you can be a practicing registered radiologic technologist. And at that point, it opens the doors wide open for future growth, as well as the flexibility of working either in a physician's practice or a large medical center. Being a radiologic technologist, you can expand your career into more advanced imaging, something like computerized tomography. Also, you can go into areas like MRI, but from there you can expand it to multiple different disciplines to provide all different types of imaging services to patients. You want to make sure that when you get into this field, you have a mentor and that you have an organization that wants to invest in your future. You want to position yourself in an environment that will promote constant learning and growth.